I know this was a game-changing moment for you when you made the decision to do this. And Tina and I have kind of joked she had a backup resume for Chick-fil-A if this didn't go well. And so you did implement this, and you made a lot of bold moves to do so. So share with us a little bit about the process and the results.
Sure. So one of the things that we knew we wanted to do, and really for me, I have the great privilege and pleasure, sometimes not a pleasure at Friday at 8 o'clock at night when someone needs an authorization, but for us, it's about the people, right? We don't think about it as a transaction. All of those requests for authorization, that is a person. That's a mom, that's a dad, that's somebody's kid that is waiting on a request, right? They're waiting to find out if they can have that biopsy to discover if they have cancer again. They need that surveillance image. They need, whatever it is that they're waiting on. That's, they're sitting there waiting on pins and needles. From a compliance standpoint, we have, 14 days for a standard review. We have 72 hours for an urgent. But why would we wait that number of days, right? We're trying to do them as fast and effective with the most quality that we can do them in. And so for us, it wasn't about, how can we do it, faster and quicker and, move those widgets. It's not about widgets, it's about people. And it's about making sure that we could get that work done and get it done at the point of care. And the point of care is at the doctor's office. The point of care is when that physician is making that request while that member is still in the office. We wanted that member to be able to walk down that hall, check out of that office, and know exactly what their next step was and whether or not that next procedure was going to be approved, and not have to wait a day, a week, or 2 weeks for that doctor's office to call them back and let them know. Because they'd already had that conversation with the physician. And here we were standing in the way, potentially, of that access to care. And that's my job. That's what I get up to do every single day, is to make sure that our members have access to care. And so for us, that was really the driver of why I feel like I should owe Jeremy a quarter for every time we say his name. Because I, too, was introduced to Jeremy Friese. So the CEO at Mayo introduced him to our CEO at Florida Blue. And then, in turn, I was introduced to Jeremy. And I certainly, like probably most people, have seen every dog and pony show that people come in and say, hey, we can automate authorizations. Sure you can. I've worked in healthcare a very long time, and I had never seen anything like this. And so we decided to take a chance and do a pilot. And so we did. And then based on the results of that pilot, we said we wanted to move forward. And so that was really a game changer for us.